Welcome to A Shot in the Arm podcast. I'm your host, Ben Plumley, and welcome to this very special set of live streams. They're quick takes happening at the same time as AIDS2020 and HIV2020. Well, I know you've been sitting in front of your computer now for 2 days, all day. So the aim here is to have short, snappy conversations about the big issues that are either on the conference agendas or that haven't made it at all. Well, today we're going to talk about the state of the HIV epidemic in possibly one of the most important countries in sub-Saharan Africa, Zimbabwe. And I'm really honored to be joined by two colleagues and friends, Joseph Murungu and Megan Dunbar from the Pangea Zimbabwe AIDS Trust. And I should get Joseph's surname right, Joseph Murungu.
Murungu.
What's wrong with me? Megan, Joseph, welcome to the show.
Thank you. Thanks for having us.
Thank you.
So, Joseph, can you tell us a little bit about Pangea Zimbabwe AIDS Trust, what it does, and how it came to be? We are obviously connecting live with Zimbabwe, so we may have a few technical troubles along the way. I'm just going to try one more time. Joseph, are you there? Can you tell us a bit about Pangea Zimbabwe AIDS Trust? No? In which case, Megan, over to you, because I know you were one of the early founders of it. What does it do?
Well, Pangea Zimbabwe AIDS Trust is a local organization that was actually founded as a sort of satellite or sister organization to Pangea Global AIDS, which obviously you and I have a history of working together with Pangea. And it was really founded as a way to provide some innovative approaches to conducting research and using evidence to try to push forward progressive policies and really to support the Ministry of Health in Zimbabwe to do the work that they are so good at doing, which is putting together really strong technical approaches to confronting the HIV epidemic in Zimbabwe.
And how is the AIDS response going in Zimbabwe? I mean, you know, it's been at the forefront of implementing new technologies, but how are you seeing things in terms of treatment and PrEP rollout?
Yeah, I mean, I think Zimbabwe has done an extraordinary job in rolling out and scaling up treatment in particular, and especially in light of the economic challenges and some of the political challenges that it's faced over the last decade and even longer now. There's amazing leadership within the Ministry of Health in Zimbabwe, within the AIDS and TB program, and kind of within also the sort of ancillary services such as reproductive health and maternal and child health. And so, you know, treatment is really widely available, and it's being you know, it's really at scale at this moment. And so, you know, that really, I think, has been a major achievement of the country. And then I think in terms of PrEP, it's still a little bit at the beginning phases of scale up. You know, it has made a lot of progress in terms of its policies. There's, you know, it's fully integrated into the HIV treatment and prevention framework. There's a 3-year implementation plan, which really highlights the approaches necessary to go from kind of small scale to fully at scale. And so all of the policy pieces are in place. I think where it's really struggling at the moment is that the resources aren't quite there to sort of move it out of the HIV specific sector and into the primary healthcare sector overall. And yet there are plans and approaches that are being that are really being put in place to enable that scale up to happen. For example, the country has recently submitted applications to the Global Fund to try to get more funding to really resource the plans that it has. So I think that it's made some really great progress, and I think it will continue to expand and scale up, in the very near future.
So, Megan, we've seen with UNAIDS the release of the new global report, which shows that the number of people on treatment is increasing. But you and I always used to go back to the data that surrounded prevention, and we're still hovering around about the same levels, and there is still this sense that we haven't broken the back of understanding how to bring prevention into scale. And I guess really two questions as they relate to Zimbabwe. One is, how do you feel the country is doing with prevention more generally? And secondly, very specifically about girls and women and options for them.
Yeah, I mean, I think that the data that came out of UNAIDS, I think, was very sobering for all of us, and especially in light of COVID, which makes reaching those targets even harder. We have some major challenges. I mean, Zimbabwe is not alone in this, obviously. I think some of the encouraging news that I've seen, even coming out of the conference, is that some of the approaches that say, for example, DREAMS has been taking to really invest in these layered prevention interventions for girls and young women really do seem to be showing that there's some positive outcomes. For example, in a session yesterday that was run on DREAMS specifically with the Population Council and LSHTM, sharing some of their results from their process and impact evaluations, really seem to suggest that these layered interventions are improving young women's knowledge about their own HIV status. It's improving their sort of relationship dynamics within their current partnerships. And some of the things that they seem to be learning is that there are different approaches needed, differentiated approaches needed for the younger adolescents versus the older adolescents. For example, among young women, it seems really beneficial to have economic interventions. And among the older adolescents and young women, it seems to be more around access to health services and support as it relates more in terms of social support. So I think we're learning a lot about what's working. And I think that, some of this evidence could really help in terms of improving things.
I think through the wonder of technology, Joseph is back.
Yes.
Joseph, hi there. Just your sense of how Zimbabwe is responding to HIV at the moment, and particularly in the light of the most recent UNAIDS figures.
Yeah. So I think the country had made significant progress towards the 95 targets. However, we missed the targets for the reduction of new HIV infections. So this comes in because of a number of issues that continue to increase vulnerability. We are doing very well in terms of the second 95, in terms of ART initiation, putting people on treatment. But the first and the third 95s continue to be a challenge. So testing coverages continue to be a challenge, especially for several population groups, including adolescent girls and young women, as well as key populations. They continue to be left behind. Some of the key issues include stigma and discrimination, but also general challenges with access to services. And then in terms of the third 90, we still have challenges with viral load monitoring coverage, long turnaround time, but also for those that didn't get their results, we continue to have challenges in terms of the actual use of the results to improve patient management. COVID-19 has created additional challenges, but I'm happy to announce that the ministry, in collaboration with partners, they've also put in place measures to try and ensure that we continue to provide services and don't lose the gains that we have achieved thus far, focusing on differentiated service delivery and other interventions.
So, Joseph, I'd love to ask you a bit more about that. I mean, UNAIDS, WHO are also saying that, this year we may lose up to 500,000 lives of people with HIV because of a shortage of services caused by COVID-19. Are you frightened about that? How has COVID-19 actually, or has it actually started to impact Zimbabwe? Obviously, you've got the things going on south of the border in South Africa, but how about you in Harare and surrounding areas?
Yeah, so we have seen a progressive increase in the number of COVID cases, and I'm definitely worried about not just the impact of COVID in general, but also on the progress that we've made in terms of the HIV response in the country. We have just gone over 600 cases in country, but most of the cases are imported. So, we definitely need to see an improvement in terms of COVID testing coverage. I have a concern because we have been seeing a progressive decline in terms of the HIV-related deaths since 2010, and I'll be worried about what COVID has and how it has impacted on access to treatment, access to prevention services, as well as adherence and monitoring services. So yeah, we are likely to see a negative impact on both new HIV infections as well as HIV-related mortality in the country.
And have you found that partners like the Global Fund, like PEPFAR, I mean, Zim is not technically a PEPFAR partner country, but there is significant investment there from US donor aid. Are you finding that they are supporting you in being able to sort of pivot to deal with the priorities, the emergencies of COVID-19?
Yes, I think that the partners have been very supportive. We have just had approval of the Global Fund COVID-19 grant over and above the standard grant that we applied for earlier this year. And then PEPFAR has also been very supportive because through their implementing partners, they've supported both the COVID-19 response as well as making sure that services for HIV, TB, and malaria continue to be offered in the public sector as well. So they've been very responsive, but also over and above Global Fund and PEPFAR, we've also seen continued support from the other traditional multilateral and bilateral partners. So yeah. It's a challenging environment, but I think the partners have been very supportive.
So Megan, besides Zimbabwe, you work in a number of countries across sub-Saharan Africa. How do you see the region as a whole preparing for COVID-19?
Well, I think everybody is doing their very best to confront a situation that came out of nowhere and has surprised all of us. Many of the countries that were put on notice for being potentially confronting a massive spike in infections, I think have had a little bit of a reprieve in so far as things maybe haven't hit as hard and as fast as some were predicting. And so I think that's given countries a chance to, just to put some plans in place. I think one of the major challenges is that, the way that European countries and the US have managed to try to to some, to varying degrees of success, obviously, put lockdown measures in place to try to limit the transmission of the virus. In a lot of these places, those sorts of lockdowns, while they may have been put in place, are likely to have limited effectiveness, just because in many places that type of sort of sheltering in place and social isolation is just not possible when you're dealing with very crowded, high density urban areas, poor areas where you don't even really have access to all the essentials that you would need close by and in your neighborhood. I think that, as a global response, we're probably really going to need to think about, like, how do you try to implement measures in those sorts of settings that will really be effective. If sub-Saharan Africa, for example, is to see the kinds of spikes in infections that we've seen here and in Europe and other places like in Latin America. Yeah, and Joseph, I know you're a part of the technical committee working on those issues at national level. I wonder if you guys have had some of those conversations, and if you have any insights into what types of responses are being discussed in the region. I'd be curious. I think it'd be great to hear from you.
Thanks, Megan. I've participated in some of the discussions, and like in Zimbabwe, it's a multi-sectoral and also quite a comprehensive response, cutting across 9 pillars that range from just the case management and surveillance, to ensuring that services for HIV, TB, malaria, and maternal and child health and general primary health care in general actually continue to be offered. But over and above that, we are also then looking at other key issues, including nutritional requirements, mental health issues. So it's quite a comprehensive approach, but I think we are also in the midst of some challenges in terms of other health system pillars, such as the human resources, that they need to be looked into.
Oh, I expect especially around things like contact and trace and contact programs. But Joseph, the Zim COVID response has a central coordinating function. Is that within health and childcare, the Department of Health and Childcare?
So we have a national COVID plan. So it cuts across many sectors, and I think just to demonstrate political commitment, it's actually the steering committee is chaired by one of the vice presidents, and this cuts across different ministries. So we then have an interministerial committee within that. But within the Ministry of Health, we then also have a coordination mechanism chaired by the permanent secretary, and most of the health partners are represented in there.
Well, it sort of sounds to me as if that's the kind of response that we in the United States could benefit from. So maybe we should be asking you for some technical advice on how to avoid what's happening here. Joseph, right at the start of the show, when we were having some technical challenges, I was very keen to get a sense of what Pangea Zimbabwe AIDS Trust is, and Megan very valiantly jumped into the fore. But could you just tell us a bit from your perspective about what PZAT does?
Mm-hmm. Thank you, Ben. So we are a locally registered organization with a primary focus on HIV. So the whole spectrum, HIV prevention, care and treatment, as well as sexual and reproductive health. And more recently, we have moved into primary health care. So our focus is to improve the quality of life among people who are infected and affected by HIV, with a bias towards key and other vulnerable population groups. So our scope of work includes advocacy, focusing on policy and issues to do with access and quality of care. But we also focus on providing technical support to the Ministry of Health in terms of development of strategic documents, guidelines, as well as building capacity among service providers. We are also involved in direct implementation of services. So we support the delivery of HIV prevention, including oral PrEP in several districts. We are also supporting primary health care in rural districts as well. So our scope is quite broad in terms of the work that we do in the country.
It's sort of, it
routine,
brings sort of quite some pride to the heart, because of course Pangea Zimbabwe AIDS Trust was affiliated with Pangea Global AIDS Foundation, which was rooted here. And as Megan said, she and I worked, well, we were Pangea, I guess, from the international side for a number of years. So it's really wonderful to see the success that you've had and the contribution that you've made. You know, it's really good to see that flowering continuing. Joseph, have you had to be sheltering in place during the last few months? And if you have, what has been your strategy to cope with that?
Thanks, Ben. Yeah, we have gone through different levels of the lockdown, and I must say it has been a challenge. Coming from as someone was being used to going with friends after, then coming back home and so forth. Yeah, so it has been a challenge, but I think continuing to engage with family, friends, and colleagues via social media has been quite very useful. Yeah, for me.
Well, I hope you and your family are staying safe. I mean, Megan, across the bay, here I am in San Francisco, there you are in Berkeley. How have you been coping? What have your coping mechanisms been?
Well, similar to Joseph, a lot of online socializing. I have happy hours with friends every Friday afternoon. We had a Zoom graduation party for my daughter when she graduated high school, and that was actually quite a lot of fun. I've been getting out and going running a lot on my own and with my daughter. So for me, it really, I think the saving grace has been the opportunity to get out and spend some time in the great outdoors, given that we live in such a beautiful environment. But yeah, it has been a challenge, but I guess we're all facing it together.
Exactly. We're all facing it together. So any final thoughts, anything that we haven't covered that, you know, you feel it would be useful for listeners and viewers of A Shot in the Arm to know about what you guys are doing in Zimbabwe? And Joseph, maybe I could start with you. Any key message you'd want us to know?
Yeah, I think for us, we have been trying to push more on integration. So we are looking at integration of HIV prevention services with sexual and reproductive health services, including family planning. So the same ideas are also working for HIV and TB, HIV and malaria, HIV and maternal and child health, and now COVID, because we realize the benefits in integrating these services. Yeah, although there are barriers, I think it is actually possible to integrate services for the benefit of the population in general. So would appreciate any collaboration across the different programs in terms of ensuring that we improve the quality of care. It's comprehensive, holistic, and integrated.
And Megan, any final thoughts from you?
Yeah, I was just wanting to say that I think this time that we're in, where we as a global community are really being made aware more and more of the inequities that we find in access to HIV prevention, care, and treatment, and all other health services. This time is really an opportunity for us to continue to invest in trying to address those inequities and disparities. And really, I think, as was highlighted in one of the sessions this morning, the plenary with Greg Miller, we are never going to end the AIDS epidemic until we're able to fully address those inequities. And so I think that's just a general thought. And as far as how that relates to PZAT, as was said, PZAT really hones in and focuses on trying to address some of those inequities and injustices. And I think that, I think that we should really acknowledge PZAT's legacy in that area in Zimbabwe, and really thank Joseph for the work that you guys are doing to carry that forward.
Well, Joseph Murungu, Megan Dunbar, thank you very much. Thank you so much for being on the show. Well, everyone, that's the end of this episode. Hope you enjoyed it. Hope you are taking good care of yourself. Stay safe, and stay healthy. And of course, don't forget to wear a mask. Thank you very much.
Thank you. Thank you, Ben. Bye-bye.
Bye.
Yeah.